Hello, this is Mandy O'Brien, and I will be discussing reality shock in graduate nurses. Upon completion of the presentation, the learner will be able to describe 3 feelings graduate nurses may experience when transitioning to their new role, describe 3 ways graduate nurses may try to cope with reality shock, and list 3 interventions to improve the transition from nursing student to graduate nurse to help minimize reality shock. Reality shock is essentially when new nurses find themselves in a work situation which they have spent years preparing themselves for and thought they would be prepared for it, and suddenly realize they are not prepared. This can be associated with feelings of fear, uncertainty, isolation, anxiety or depression, and vulnerability. This transition shock can cause the nurse to be fearful of making mistakes and feeling unsafe in practice. It can be crippling to a new graduate's confidence and self-image. It typically occurs in the first few months after starting their first job, usually after completing orientation. Graduate nurses will start to lose their idealized perception of the nursing role, become disillusioned, and often leave the profession. There is speculation that with the professionalization of nursing and nursing education being moved from hospital-based programs to college programs, that graduate nurses are less prepared for this transition and more likely to experience reality shock. There are ways in which graduate nurses cope with reality shock. Relief measures used to reduce the performance anxiety associated with the transition include acting out, either overtly or covertly, withdrawal, somatization, or more positively, through motivated learning. Reality shock does have an impact on the profession of nursing. The first year of nursing practice has been noted to be the most difficult during a nursing career. This initial time frame helps shape a nurse's professional identity. Nurses may develop cynical feelings toward the profession and not deliver high-quality, compassionate care. Reality shock can also impact patient safety and decision-making. For example, graduate nurses may delay contacting providers until a patient's condition is serious due to fear, lack of confidence, and insecurity. Or, graduate nurses may feel overwhelmed and socially isolated when needing to make clinical decisions, and critical thinking may be beyond their capabilities. Reality shock for graduate nurses can also impact healthcare and society. Nurses are leaving the profession, with graduate nurses exhibiting the lowest retention rate, with approximately 25% leaving their jobs within the first 2 years and nearly half within the first 3 years. The cost of training and recruitment of one nurse for an institution may cost up to $88,000. With healthcare dollars being stretched, these costs need to be contained. Workforce shortages will eventually impact the delivery of high-quality care. So, what can we do to help with reality shock for graduate nurses? Research has shown that support of new graduates from both nursing colleagues and the organization during this transition period is beneficial. Transition programs like nurse residencies, internships, or mentorships and preceptorships, simulation experiences, networking with other novice nurses, planned and appropriate workloads, readily available resources like clinical educators, and reflection through journaling are ways in which to help bridge the gap from student nurse to graduate nurse. These interventions have been shown to increase competence, confidence, job satisfaction, critical thinking, and reductions in stress and anxiety. In summary, the phenomenon known as reality shock for graduate nurses entering the field has an impact on personal, professional, and societal levels. The literature supports using a variety of strategies and interventions to help improve the transition from student to graduate nurse. What do you do to help minimize reality shock for graduate nurses in your work setting? Thanks for listening.